Laboratory animal handling technique. Mouse, rat, rabbit. Adjective. To comply with the Animal Welfare Ordinance and avoid mishandling of animal in research. To provide basic concepts of animal handling technique to new animal user. While offering our concept and techniques to our animal user, we also encourage comments from experienced animal users. By doing so, we would enrich our knowledge in the field of laboratory animal research on both sides and further benefit animal welfare as well as the credibility of research result in our university. Laboratory animal handling technique, rat. A. Intraperitoneal injection. B. Blood collection from tail vein. C. Blood collection from cardiac puncture. D. Oral feeding. E. Sucksing. Intraperitoneal injection in rat. The most common method of administering drugs to rats. Tools for intraperitoneal injection in rat. 75% alcohol cotton ball for surface disinfection. Medium-sized towel for restraining the rat. 25 G 5/8 needle with 1 cc syringe for injection. Let the rat relaxes on the top of the lid. Stretch the body of the rat by pulling up its tail and then cover the rat with a towel by your left hand. Fold the skirts of towel under the rat from all directions. Grasp up the left hindlimb of the rat to expose the abdomen. The injection site should be in the lower left quadrant of the abdomen because vital organs are absent from this area. Only the tip of the needle should penetrate the abdominal wall to prevent injection into the intestines. Collection of blood from tail vein in rat. General anesthesia needed. Small amount, 0.11 ml. Tools for collection of blood from tail vein. 75% alcohol cotton ball for surface disinfection. 27 G 1/2 needle with 1 ml syringe for blood withdrawal. A vial for blood collection. Optimal site of blood withdrawal is around the distal 1/3 of the tail since this part of tail gives better visualization of the veins. Disinfect the tail with 75% alcoholic cotton ball. When the needle penetrates the epithelium of the tail, pull back the plugger a bit to create negative pressure inside the syringe, then push the needle in the vein slowly until blood get into the dead space of the needle head. Pull back the plugger by the ring finger to withdraw blood from the tail vein. Using a scalpel to make a small wound on the tail is also an option for collecting blood from tail vein. Blood can be collected by using a pipette after then. Collection of blood from cardiac puncture in rat. General anesthesia needed. Large amount, up to 3% of body weight. Tools for collection of blood from cardiac puncture. 75% alcohol cotton ball for surface disinfection. 24 G needle with 10 cc syringe for blood withdrawal. 15 cc centrifuge tube for blood collection. Disinfect the left thorax with 75% alcoholic cotton ball. Search for the point of maximum heartbeat. Insert the needle straight on the selected point and withdraw blood by your left hand. Oral feeding in rat. Feeding amount limited to 1% of body weight. Tools for oral feeding in rat. 16 G ball-tipped feeding needle with siring. Leather glove. Restrain the shoulders of the rat by your thumb and index finger, then support the lower limbs with your right hand. Restrain the tail of the rat in between your ring finger and little finger. Let the rat lying on your left palm and introduce the ball-tipped feeding needle from the pharynx into the esophagus when the rat is in the act of swallowing.